Healthcare. There seems to be a standoff right now between your government and the provinces. Your focus, you say, is on results, not just dollars. The premiers want a meeting with you. You have so far resisted. Why not just meet with them? Why not just say, we're not going to get a deal, but I'm going to sit down and we're going to unblock things?
I have spoken with the premiers. I have met with the premiers more often on healthcare than any
during COVID,
other.
not quite the same thing.
Well, it is the same thing because we saw during COVID the weaknesses in our system, the gaps in our system, the challenges in our healthcare system.
Except you refused to talk to them about healthcare funding during the pandemic, right? You said it'll be after the pandemic we'll have this conversation.
Actually, that's not entirely true. Okay. What I said is we would be there during the pandemic for supports, and we were there to the tune of $72 billion on top of all our normal healthcare spending. And then afterwards, I said, yes, let's talk about the future of healthcare. And I have said consistently, we'll be there for more funding, but we can't just put money into broken systems. We need the premiers to commit to improvements on results for Canadians.
So you won't sit down with them unless a deal is worked out before?
But I have been sitting down with them.
You have not sat down and talked to them about healthcare
Not
funding?
collectively.
No.
Individually, I've spoken with almost every single one of them to express that we need results. We will be there with more money because we know we need more money. But we also need, this time, the premiers to actually make the improvements that too many of them haven't been making.
That sounds to me like a prime minister, though, who's going to pick off provinces and make side deals with everybody instead of sitting down and coming to an agreement.
Okay. If I can do anything that will help one family in one place get better services, I'm willing to do it. If not all of them want to come to the table, I will work with them individually. But I think what all Canadians need, and quite frankly what the responsibility of the federal government under the Canada Health Act is, to make sure that all Canadians can get access to universal, free, quality health care across the country, and that is what we're doing. I am not going to give them the blank check that they want because they are not making the improvements in general. Some of them are, but many of them are simply
What
not.
is your understanding of what more money would do?
More money could ensure better equipment, more healthcare workers, that more Canadians have access to a family doctor, that healthcare wait times, particularly for mental health, shorten. When someone calls up and says, I'm in crisis, you can't say, yes, you can have an appointment 6 months from now. We have to be responding to that. We've put forward money that is dedicated towards that, but we are not going to be giving it to the provinces unless they commit
to
transparency. I think Canadians have seen that for too long, money hasn't improved healthcare systems. We need to transform the system. Now, the federal government's not in the business of saying, well, how many nurses need to be on a floor in any given moment. But we can say, Canadians should have access to family doctors. Canadians should have access to this, and we're willing to fund part of it. But provinces right now are not hurting for funds. They have surpluses. They're able to send money to their provinces.
Right now. They're not going to have them for infinity. Like they want a long-term healthcare deal.
And that's why I've said we're there for the long term. But we have to make sure that if we're there for the long term, that the results are there for the long term.
I've talked to people on my program over the past few months who have come close to death on a number of occasions because they were waiting in an ER, because they hesitated to go to an ER because they were so sick. They see politicians fighting over health care and they feel like they are getting caught. And I wonder what you say to those people whose lives may be at risk because politicians, and I'm not just you obviously, but politicians can't get there, can't figure it out.
If I were to send people all the money they need in the provinces, there is no guarantees that those folks would be waiting less time in the hospitals.
Right now.
The system right now, according to the head of the Canadian Medical Association, there is no point putting more money into a broken system. Now those are harsh words, and I think there are systems that are working better than others across the country, but my responsibility is to ensure that all Canadians have access to health care, and quite frankly, one of the only levers I have is saying, I'm not giving you this money with no conditions, I'm giving it, I will fully participate in the funding of it as long as those real improvements are made.